Today, I am Quervin Zacary Roldan from DSP 181B, taking the course of Human Anatomy Physiology. And today, I'll be demonstrating on how to take vital signs on a patient and discuss its rationale. So I hope you learn from this video, and thank you. As you can see in this table, all of these equipments are being used to assess the vital signs of the patient. So we'll start with the most popular one, which is the stethoscope. The stethoscope is being used to listen to the carotid of sounds when measuring the blood pressure of a patient. Next is the sphygmomanometer. The sphygmomanometer, which consists of the aneroid, the pump, and the cuff, is also being used to assess the blood pressure of a patient. Next is the most basic one, the thermometer. The thermometer is being used to assess the body temperature of a patient and to assess whether he or she has a fever or not. Next is this little cute machine, also called as the pulse oximeter, which is also being used to assess the oxygen saturation of the patient. Next, we also have this paper and pen in order for us to take down the results of the assessment because it is very important. And lastly, we have this cotton and at the same time this alcohol in order for us to disinfect all these equipments once the assessment is done. And last but not least is a glasses because all doctors are blind. Before you begin any procedure, make sure that you do a proper hand hygiene in order to avoid the spread of microorganisms while you interact with your patients. Calling patient Pineda. Please proceed to room 715 and meet Dr. Roldan. Thank you. Yes, please come in.
Good morning, Doc.
Good morning. I'm Dr. Roldan, your general physician for today. So, may I ask your name, please?
I'm Alexandra Kathleen Pineda.
Okay. It's a very long name, so can I call you Alex for short?
Sure, Doc.
Okay. Alex, how are you this past few days?
I'm good naman po.
Okay. Are you studying in the middle of pandemic or not?
Yes po. Actually, I'm a third year nursing student po.
Okay, so you aspire to be in the medical field.
Yes, Doc. Actually, I aspire to be a doctor just like you.
Okay,
Yeah.
that's what the world needs right now because in the middle of pandemic we need a lot of dedicated doctors. So to go straight to the point, did you do any activities before coming here to my clinic?
No po.
So you went here straight there.
Yes.
Okay, so Alex, what we're going to do today is very simple. You just have to do a 5 simple procedure. In short, you have to assess your vital signs. And those are 5 procedures. So assessing vital signs is to monitor the functions of the body and note if there's any change in the health status. Okay, so I'm sure you're very familiar with that.
Yes po.
So but before that, I want to ask you a question. Listen to this very carefully. 0 being the lowest, which means you don't experience pain at all, and 10 being the highest, which means you experience the most severe pain of them all. Then, the question that I'm about to ask is, do you feel any pain in your body at the moment?
No po.
Is it 0 or 10?
0, Doc.
Okay, 0. So there's no pain. Okay, so assessing your vital signs, I have to assess 5 vital signs. First is your temperature. Second is your oxygen saturation. Third is your respiratory pulse rate rather, and then there is respiratory, and then lastly is the blood pressure. So I'm sure you're very familiar with that since you're a nursing student, especially in your third year. So Miss Alex, the very first vital sign that I'm going to assess is your temperature. So assessing the temperature by a doctor helps if the patient has an underlying cause or an infection. So I'm going to use a thermometer because fever is not actually an illness but a sign of an infection. So with this we will know if you have a fever at all. Would that be okay with you?
Sure po.
Okay, would you mind if I'm going to ask you to roll up your sleeves in order for this to be? And do you want me to do it by myself or do you want to do it by yourself?
I guess I'll just do it by myself.
Sure. just make sure. Well, I don't have a problem with you're a nursing student, so make sure it's properly in the axilla. Thank you. So the next vital sign that we're going to measure up is your oxygen saturation. So measuring your oxygen saturation helps because if an individual or a patient has a very low oxygen in the blood, it could affect his or her brain at the same time, heart and a lot of internal organs. So to measure that, I'm going to use this pulse oximeter. So you just have to borrow your index finger and put this in there. So would that be okay again?
Yes.
Okay, so you just have to wait. It's very, very fast. Okay, that's it. I told you it's very, very fast. Write it down. So Miss Alex, the next vital sign that I am going to assess is actually 2, which is your PR and your RR. Are you familiar with your PR and your RR?
Yes, Doc. PR stands for the pulse rate and RR stands for the respiratory rate.
As expected. Okay, very good. So we assess these two in order for us to know if there's problems in your respiratory at the same time in your cardiovascular system. So all I have to do is to put these two fingers in your brachial or radial artery in this part of the arm under your palm. So would that be okay? It's just 1 minute. Very very fast. Okay, that's it. Thank you so much. Just have to write it down. So Miss Alex, the last vital sign that I'm going to assess is actually your blood pressure. So we use sphygmomanometer in order to assess blood pressure. So the importance of assessing blood pressure is also to detect if there are some certain abnormalities and problems in your cardiovascular system. So in order for me to assess your blood pressure, I'm going to use this tool called sphygmomanometer. So all I have to do is put this cup into your right arm in order for me to measure your blood pressure. So would you mind again to please roll up your sleeve and please put your arm here because it needs to be on the same level with your heart. Okay. Sorry, that's not good. Thank you. So Miss Alex, I already have the results of your vital signs. So your temperature says that you have 36.7 degrees Celsius. Your oxygen is 98%. Your pulse rate is 76 beats per minute. And your respiratory rate is actually 16 breaths per minute. And lastly, your blood pressure is 110/70, which is completely normal. And everything seems to be normal. So no follow-up or checkup or what because everything is normal. So You just really have to maintain this and really have a healthy lifestyle. So more on exercise at the same time eating healthy. So thank you for coming to my clinic today, and I hope we meet again, but in a healthy state, of course. Thank you.
Thank you.
죽겠다 또 어김없이 너의 흔적이 나만 날 괴롭힌다